Good morning, everyone. I'm Charles Shapiro, President of the World Affairs Council of Atlanta. Our program this morning is on the COVID-19 crisis in India. Our guests are Mr. Manoj Gopalakrishna, CEO of CARE India, and Dr. K.M. Venkat Narayan from Emory University here in Atlanta. We're co-hosting this program with Global Atlanta Online Magazine. The program is sponsored by the UPS Foundation and the members of the World Affairs Council of Atlanta. We've got the purpose today is dual. Number one is to get everybody brought up to date with what's going on in India with COVID. And the second purpose is to raise funds for CARE India. I want to give a special welcome to Anita Nainan, the chair of the Indian American Chamber of Commerce of Atlanta, Paulina Guzman from the City of Atlanta Office of International Affairs, Aureen Richards-Barr and Elliot Page from Hartsfield-Jackson Airport, and Andy Bob from CARE USA. Let me turn it over to you. This is to Trevor Williams, who is the publisher of Global Atlanta Magazine. Trevor, why don't you talk for a couple of minutes?
Great, thanks, Charles. As some of y'all know, Global Atlanta is a news service. We cover Atlanta's ties with the world, and really there's no country that is both more consequential for the future and yet more misunderstood than India, which will soon become the world's largest population and is home to, as our Consul General likes to say here, a fifth of humanity. And then locally, of course, the reach is long as well. There's a diaspora of estimated more than 100,000 people here in Georgia. Companies have invested billions, from Novelis to Burla Carbon, Wipro, Tech Mahindra, all the names that you've heard in the tech sector. The country is a laboratory for fintech innovation. That's a sector we see Atlanta as being a global leader. And of course, security ties are growing more important these days with the Quad and efforts to secure the Indo-Pacific, and defense is becoming a big industry in exchange. And of course, that's very strong in Georgia, including the Lockheed Martin plant here that manufactures with parts that are built in India. So with all that in mind, we at Global Atlanta, we've taken a few reporting trips to the country over the years and hope to do that as the COVID scourge is under control. In the meantime, we're continuing to cover the ties here. And of course, today we're happy to discuss health, which is an important dynamic in the bilateral relationship. India, of course, is both a contributor to the world through the manufacture of vaccines and medicines, exportation of experts like our panelists today. So I'm going to go ahead and do a little bit broader introduction of our two panelists. Both of our speakers are uniquely qualified to give us some deep insight on this particular moment. So we've got K.M. Venkat Narayan, who is the Ruth and O.C. Hubert Professor of Global Health and Epidemiology at the Rollins School of Public Health at Emory University. He's also a professor of medicine. He's also the director of the Emory Global Diabetes Research Center and has a long history that we will not get into too deeply in epidemiology, product of 3 continents, and has studied quite extensively on a variety of epidemiological topics. We'll get him to elaborate a bit more about his background as we get into the panel. But also we've got Manoj Gopalakrishna, who is the CEO of CARE India. Manoj is an accomplished executive. He is a Wharton School alumnus and has over 25 years of experience in global and Indian organizations. He, prior to joining CARE, was with Hindustan Latex Limited. He also worked with Becton Dickinson and Company as its managing director, leading South Asia operations. So I won't delve too deeply into their extensive bios. I just want to turn it back over to Charles for our discussion.
Great, thanks, Trevor. So the New York Times this morning reports that there were yesterday 4,120 deaths in India and over 360,000 new cases. Mr. Gopalakrishna, you're living this. Can you tell us what you're living this every day? What do we need to know 9.5 time zones away? What do we need to know that's going on in India?
Good morning, and thanks for having me on this panel. Let me just tell you maybe how are we experiencing this challenge at this moment of time. So it was completely a bolt out of the blue when the whole second wave started, almost like a month back. None of us were really anticipating Neither the government nor the NGO sector nor the health sector was anticipating such a kind of a strong second wave coming. So I think it started from Mumbai and then it moved to Delhi. And currently, if you see in Delhi, the number of new infections is dropping. But at the same time, the south of India, now I think you can see that the number of infections are going up. So I think India, number one, is not kind of a one COVID pandemic that you see. There are multiple pandemics at play, possibly involving multiple viral strains. So that's an important aspect of the way the COVID pandemic is evolving in the country, so that we need to have very context specific response at speed based on what is the emerging need in that particular geography that where we are working. So that kind of a uniqueness is one aspect of what we should really be doing, so that just like about everything in India, don't look at it only from one lens. There are multiple, epidemics and multiple strains involved in different parts of the country. And at this point of time, as the north of India is finding maybe a little bit of control on the new infections, the south it is going completely out of control. But fortunately, the good thing is that south has a reasonably stronger health system, so that it may be able to contain it much more effectively than maybe a Delhi or some of the North Indian states, which has very fragile health systems.
What's been the impact in, I'm assuming that the health system is not as strong in rural areas. Has there been a graver impact in rural areas, or are there social class differences? Are the wealthy exempt and the poor are more exposed?
I think one thing that we have seen in the second wave, which we have not seen in the first wave, is that the rural India is also highly impacted. And that is actually the places where you don't have big hospitals or effective healthcare systems. So we see that there is a lot of burden which has come into the rural during this point of time. And their own health seeking is fairly late in comparison to maybe an urban citizen. So that itself has its own consequences that we are seeing. People seek care maybe very late, too late for them to really get into the kind of treatment cascade which possibly somebody from the city will have access to. And even within the city, you see that once you have limited number of critical care beds, there is a kind of mad scrambling to get the critical care bed that you need. India as a country, we only have 90,000 critical care beds for 1.4 billion population. So this is a huge systemic gap that we are trying to really address at this point of time. So it's very important that from a response point of view, we have to really think about declogging the tertiary care system so that the most essential patient actually gets the tertiary care bed and the critical care bed. So I think that's important for us to really use the limited resources in the most effective fashion.
Dr. Narayan, there's a lot of speculation that the official figures don't reflect the reality, that the official figures reflect hospital deaths, but not total deaths. Do you know, the official figures for yesterday were 4,120 deaths. How accurate is that?
Yeah, it's difficult to know. I mean, in general, as far as number of cases are concerned, it's true that in all countries, the number of reported cases is about 1/8 or 1/10 the actual number of cases in the community. And I think that's because it's a function of ascertainment and testing. So I think one can safely assume that the number of reported cases will be a huge underestimate. That's something that we should definitely remember. Secondly, as far as number of deaths are concerned, again, it's difficult to know how much of undercounting there is, but there have been reports of counting deaths from crematorium and burial sites in several cities, indicating that there is probably a substantial undercounting happening. How much of this is accurate or true, we don't know, but I would think there is undercounting.
Mr. Gopalakrishna, the US news media was full of stories about oxygen being in short supply and hospitals running out of oxygen. Is that still the case? Or has that problem been resolved?
Okay, that's a classical demand supply problem that we have seen. Let me start illustrating that with Delhi. Delhi as a city normally has a consumption of around 250 to 300 metric tons of oxygen. So with the spike of cases coming in, the requirement for oxygen went up to almost like 700 metric ton. So that means literally doubled in terms of the requirement. And Delhi doesn't produce oxygen. Much of the oxygen that is used in Delhi is produced almost like 1500 miles away from Delhi. And transporting oxygen is a lot more tricky business. So I think that has been one of the main reasons why we had major challenge in Delhi. And so when the supply went up in the last few days to around 700 metric ton, now Delhi's oxygen need has been more or less met. So now we are seeing the same kind of phenomenon coming up in, say, the southern state of Kerala or Tamil Nadu or Karnataka. As your oxygen consumption is really going above 2 times your normal, consumption, there is a massive strain. And since the supply chain is not fully streamlined, you're not able to really meet that demand. So I think that's the real reason and fundamental driver of the oxygen crisis that we are really hearing.
There've been great photos here, people loading the equipment that one needs to concentrate oxygen and flying it into India. Is that having an impact?
Yes, of course. I think suddenly you are able to see that most of the hospitals have concentrators, and that will solve to some extent the problem, but not fully solve it. And then there are some assistance group who started putting up captive plants in some of the locations. So I think there are concerted actions going on. It'll take a bit of time for the whole thing to really play out. So the only fundamental way to resolve it quickly is to ensure that you establish strong transport system. So if you see, government has imported fairly large number of cryogenic tanks which are used in the transport of oxygen. Then they have put up actually specific oxygen trains which are going from state to state supplying oxygen. But only thing is that ramping up this supply chain is something which happened in the last 1 week when the problem was at the peak.
Right, that makes perfect sense. Dr. Narayan, in the end of last year and January of this year, everyone thought that COVID-19 was under control in India. What happened? Was it just complacence? People took their eye off the ball?
Firstly, clearly what is happening in India, the second wave is unprecedented. It's really huge. But having said that, several people alerted that a large second wave could happen. There was an interview, a documented interview in January by Professor Srinath Reddy of the Public Health Foundation of India, published in the Deccan Herald, where he basically warned that caution should continue. And Dr. Brahmar Mukherjee from University of Michigan, who's been following data, tweeted in February saying that the signs from the data warn a huge pandemic wave coming. But clearly, like you said, in all of last year, India kept the lid down very well. But clearly from December, January onwards, for a variety of reasons, because rates were going down, both the political leaderships at all levels and the public, started lowering their guards very substantially. And number one, so that clearly, you had large weddings, large festivals, religious congregations, election rallies, all of that happening, which conveys a signal of normalcy when the country was not ready. That is a major thing. Yeah, that's a major thing we cannot forget. But more importantly, the window of time that is available to plan for the eventuality of a large, second wave was not utilized. So a lot of the shortages in stockpiling you're talking about could have been addressed differently had the warnings been taken more seriously and more prevention, caution being put into the system. I think that's the lesson we learned from the United States all through 2020, where things did not work very well. And now we're learning it differently in 2021. So I think what is happening in India is really an amplified version of the chaos and confusion that we went through in the United States in 2020. If there is a lesson, we're all in this together. And we need to exchange lessons and be a little humble about managing this pandemic.
Humility is not something we do well in the United States, is it? Mr. Gopalakrishna, can you talk about what care India is doing specifically? I mean, where are you focusing your efforts? Are you working with state health ministries of the individual states or with the national government? What are you doing? What's Care India doing?
Thanks for that question. In fact, at this point of time, we are working at all the levels, starting from the federal government to the various state governments. Actually, CARE's response, I can say that it is on three pillars. The first pillar is focused on setting up makeshift COVID hospitals along with the state governments. So here what we do is that we put 100-bedded facility which has access to oxygen, access to basic medication, the specialist and the resident medical officers and the nurses, full-fledged makeshift hospitals for catering 100 beds. So this we had the first one going up in the state capital of Bihar, which is a city called Patna. So that's where we started the hospital almost like now 10 days back. Even today, the hospital is full, and we have now just commissioned another makeshift COVID hospital in the same city because we have increasing loads of patients out there. So now we are actually creating those COVID hospitals in state capitals of states like Uttar Pradesh, Madhya Pradesh, which are all 100 to 200 bedded facility. The intention is that all mild to moderate cases are very effectively managed there. And if they need critical and emergency care, they get referred to a higher level hospital. So this helps a lot in terms of declogging the tertiary care system so that you get a lot of people who need care into the makeshift hospital fairly early, and then you manage the mild and moderate symptoms. And you have a triaging mechanism in case they need a critical care in a higher order facility. So that's the first pillar of our response, working with various state governments in the country. And they are actually active partners when we set up a makeshift hospital. The second pillar of our response is centered on strengthening the oxygen systems in the hospital. So here actually we are supporting with getting oxygen cylinders, getting plants, oxygen plants installed, which will kick into action maybe in next 2 to 3 weeks, and then setting up transport systems for oxygen, and then ensuring that access to machines like BiPAP that is used for non-invasive ventilation is easily available in the hospital system. So we ensure that some of the critical supplies to the hospitals are made available, whether it is mostly the large government hospitals are what we are working with. And the third pillar is a lot of focus on community, because we feel that now since the epidemic is moving more towards the rural and they don't have the health facility. So we need to train our frontline health workers in using pulse oximeters and measuring oxygen saturation and regular monitoring of the patients, and ensure that they're referred to the right healthcare facility if they need hospitalization. So these are the three key areas on which we are supporting. And we also have a technical team which works very closely with Ministry of Health, Government of India, in terms of helping them with the supply logistics of all the assistance coming from different parts of the world to distribute it to the different states. So I think that's the response that we have put together in the last couple of weeks. And currently, all of our teams are fully engaged, and we have almost recruited 2,000 doctors and healthcare workers to run the makeshift hospitals in the last 10 days.
How do you deconflict with other donors so that you don't have the same oxygen equipment going to twice to the same hospital instead of going to two different hospitals?
I think one good thing that is happening is that there is a lot of harmonization of effort that is happening. So like, for example, when we go to a state capital to put a unit together, we work first with the state government. And every other agency also who wants to work in that geography will come to the state government. So there is a lot of coordinating mechanism which operates locally, so that if somebody is willing to give ventilators as donation, you will take and deploy it in that particular facility, rather than taking ventilators from everybody and keeping it in an unused condition. So there is a lot of coordination that is happening on ground between the various donors who are working. Just to give an example, American India Foundation is another large NGO who is also into the COVID relief work. So we are now collaborating with them in terms of identifying which cities that we could really set up the makeshift hospitals so that we don't really duplicate efforts. Other large NGO called United Ways. So they are actually into a lot of commodity distribution. So we actually partner with them to see that some of the makeshift hospitals that we run, how do we really get the oxygen concentrators and ventilators and all those equipments from them rather than we buying it. So there is a lot of harmonization of efforts which is going on at the operating level.
Dr. Narayan, we need to learn this lesson you've said. What are the lessons for other densely populated countries like, first of all, Bangladesh right next door, but for Indonesia, Nigeria, Philippines further away? I assume that the 617 variant isn't just staying in India, but obviously it and other variants are developing. What should other countries be doing?
I mean, I think clearly, as you said, I mean, the 617 variant is already detected in 17 or 18 other countries worldwide, including the United States. Okay, so the virus respects no borders. That's something that we can't forget. It's a highly transmissible virus generally, and some variants are more transmissible than others. So essentially, the pandemic is not behind us. No country currently should feel safe that the pandemic is behind us. So the more densely populated, under-resourced countries need to take that cautionary message much more seriously. I mean, clearly, there's got to be mask mandates have to be implemented. You know, you need universal mask mandate. Secondly, crowding should be avoided. You know, particularly crowding indoors should be avoided. The countries need to get prepared for eventualities. They need to do the stockpiling of medications, of oxygen, getting their health system prepared, important. But very importantly, data needs to be accurate and open and independent. I think that is an important thing. The more data are open, the more those data are shared with experts across the countries and across the world, the better, because that way we are not working in the dark, and we are able to see what response is needed. And finally, you know, having vaccines is wonderful, but it's going to take an organized, well-planned vaccination program to bring things under control. I mean, in the case of India, which manufactures 60 to 70% of the global supply of vaccines. So there's no dearth of vaccine manufacturing capacity. But currently, according to national data in India, just about 3% of Indians are fully vaccinated, and about 17 or 20% have had one dose. So to ramp that up is going to take supply chain, for the vaccine manufacturing, ensuring quality assurance of the cold chain and transportation, ensuring the logistics of delivery in a very decentralized manner with good monitoring at the national level and local state levels, and overcoming vaccine resistance, communicating properly to the public in a way that people will uptake the vaccine. So I think all of that is going to be required. So I think the crisis that is happening is just telling us that this could be the beginning of a long, long story. And unless we take action now in a very collaborative manner, India, like Manoj mentioned, is a very large, heterogeneous country. So is the United States in certain ways. So we can learn from each other. And I think global collaboration is going to be extremely important. I think no country is alone in this fight. So, if India needs to be safe, for the rest of the world to be safe. And, I think it's important that we play this together. And like you mentioned, like Trevor mentioned, India is such a central, large country of nearly 1/5 of global humanity. And a disaster in India could be an economic and security disaster for the whole world. So I think we all need to take care of this and take care of one another.
Mr. Gopalakrishna, how much money does Care India need? I mean, if you're receiving twice as much money, you could do twice as much work. What do you need? How can we be helpful?
I think I'll just say that across the 3 areas of assistance that we are working, today actually we have some resources to really scale the work, which is what we are currently doing. But I'm sure that in another couple of weeks, we will actually need more resources for supporting a lot of work at the community level. We talked a lot about vaccination, so that even to get the whole communities vaccinated, I think that whole logistics management support is something which is going to be humongous, and we need to really get prepared for some of those work. So I think that's an important area where we will need a lot of resources. Other area is to look at ensuring that some of the systemic strengths are built to deal with any further pandemic situation. So this is a realistic time to make an assessment on how do you really strengthen the health system? Because I think the fault lines are very visible at this point of time in terms of where we were not able to get the health system respond. So I think some of those health system strengthening work is going to be there in the medium term, which will need substantial resources to really come in. So if you ask me what you need immediately, we were looking at maybe fundraising for setting up more makeshift COVID hospitals so that we could actually set up more facilities in different parts of the country, strengthening the community response so that the rural COVID response is actually much more enabled. And then there are some critical infrastructural issues of the existing hospitals which needs to be addressed, and helping the hospitals to address that. So these are the three areas on which we will definitely need further resources to really go further at scale and speed.
And let me remind everybody to please send questions in using the Q&A function at the bottom of your Zoom screen. Mr. Gopalakrishna, a number of nonprofit, non-governmental organizations have reported that they've run into bureaucratic barriers bringing money into the country to help alleviate the crisis. Has CARE India run into any of those issues? And if so, have you been able to resolve them?
Okay, let me just give you a bit of background, and then I'll tell you specifically about CARE India, how are we dealing with it. So I think a few months back, government has brought some structural changes in the way Indian NGOs receive foreign contribution. So this was actually legislated and passed as a kind of an act to which all the NGOs should have complied with. So one of the critical requirements there was to have a bank account opened in one of the government-owned banks, and that will be the prime bank account through which NGOs will receive the funding. And government gave roughly around 5 to 6 months for people to complete the procedural requirements. So that as of date, the deadline for doing that was 31st of March. So when the deadline hit, only 16% of the NGOs entitled to receive foreign contribution had actually got that registration done. So I think that has been a big bottleneck. So the NGOs who got their bank account activated, CARE is one among them. I think we don't have any problem in terms of receiving money and moving money down into the implementation.
Oh, that's great. That's good to know. That's good to know. I've got a question from the audience, so let me start with this if I can find it here. This is from Dr. Jagdish Sheth from the Goizueta School of Business at Emory University, and I'm going to address this to both of you. This is you can mandate wearing masks and you can mandate social distancing, but people don't necessarily follow those mandates, as we know here in the United States. What can corporations and religious leaders do to motivate people to wear masks and keep social distance in public places, especially at religious festivals?
Okay, I'm happy to take that question first. Our experience is that there are several things that are important. The tone that is set by political leadership and by important champions and corporate leadership is extremely important. For example, 60 members of the US National Academy of Medicine, Black members, gave a video on the importance of vaccination to the Black community, and that has a very powerful message. When President Biden is always in public with a mask, it sends a very important message. And similarly, when church leaders, when temple leaders, when corporate leaders all do that, and emphasize it, it has a huge responsibility, number one. And secondly, I think the fact that the virus is spreading so fast and so furiously means we have to put some inhibitions on being permissive about large gatherings, whether it is large religious gatherings or large secular gatherings. They all need to be restricted. And I think that has to start from the top, and that will influence the public. So I think, and the media needs to play a responsible role. So it's a combination of nudges and incentives and of setting the right tone. I think that's the way, that's what makes it happen. So that you can't escape from the fact that this virus is dangerous, and it's not health versus economy, because if you don't get health right, the economy is not going to come right. So they are intertwined.
Mr. Gopalakrishna, would you like to add to that?
Sure. In fact, I think I fully agree with the approach that Venkat was outlining. I think what we need is a very structured social behavior communication campaign and approaches, because I can draw a lot of parallels between the work that I did long back for HIV, where promoting condoms was one of the most challenging tasks, especially among the most vulnerable populations. And it took a bit of time. And I can tell you some of the states in India which did extremely well are where actually the chief ministers of the state went and said, I endorse condom usage. So that there was a lot of social normalization which happened in terms of using, and then it became a kind of a norm. So I think we need to do a kind of a very structured behavior change communication program involving the most influential people in the society to ensure that COVID appropriate behaviors are consistently practiced.
That's great. And I just want to add here that Dr. Sheth asked me to announce that he and Madhu Sheth, his wife, pledged $2,000 to Care India from the Sheth Family Foundation. So I hope everybody will be inspired by Dr. Sheth.
Thank you, Dr. Sheth.
Yeah, Trevor Williams gave me this question ahead of time. It's a little complicated coming back on, but I think this is from Mr. Gopalakrishna. There's been so much in the news about the digitization of India's economy, where almost everybody has cell phones. There's easier access to money transfers. I think the entire population has electronic biometric ID cards. Is this helpful in fighting COVID? Is it irrelevant? I mean, I don't want to say irrelevant, but not central to dealing with COVID? How has this huge shift in the Indian economy and Indian culture impacted the fight against COVID?
I think the digitization actually has been fairly deeper in the country in different walks of the life. But if you really see how much of that digitization has been used in fighting the pandemic, that is where I feel that we still have gaps. So we have things like for vaccine delivery, we have an app where actually you go key in and schedule your appointments, you get your certificates, and that was used to really ensure that all the vaccine beneficiaries are tracked. Then there is an app which the government introduced for tracing, contact tracing support. I think many of this has been deployed, but maybe the last mile, how did you really use a lot of the data that is coming out of this app to really guide your day-to-day programmatic decision, day-to-day outreach decision? That is where I see a bit of disconnect. So we have very strong leverage that we have used of our mobile technology and the mobile apps that we have, but maybe the deployment of that data into improving quality of our service delivery. So that's where we still have a lot of journey to really cover.
This is a question from David Mills to Mr. Gopalakrishna. How is access and supply of clean water, masks, protective equipment for medical personnel, hand sanitizer for individuals, how is that supply in India?
So in the wave one, a lot of the focus that went was to ensure that at least a lot of stuff like the sanitizers, masks, clean water in the facilities are made available. So I can say that at least in the healthcare facilities, there has been a substantial improvement in access to sanitizers and masks because of the kind of preparatory work which happened in the wave one. So if you look at the larger community, still access to sanitizer may not be that great. You may have access to mask, which is better. So I think there are areas of further work needed to bring it down to the lower levels of health system. But at least at the tertiary care facility, I can say that you have reasonably good access to mask and sanitizers at this point of time.
Dr. Narayan, I'm going to ask you to explain to laymen like me, what the hell is a variant? I mean, is there an algorithm that for every so many people who come down with COVID, that a variant will develop? Or, I mean, how does that work? And why are, I'd never heard the word before, and suddenly everybody's talking about variants.
I mean, essentially, it's a virus. This is an RNA virus. It's an RNA particle. So the virus is trying to survive despite human efforts to try to block its survival. So the virus is smarter than we are in some sense. So what the virus genome does, it tries to adapt itself by changing its structure, changing its composition to try and overcome any immunity you might build against it. So the more susceptibles there are in a population, the fewer who are vaccinated, the greater the opportunity you provide the virus from changing itself. So it's really, there is no prediction. You can't predict how many variants will arise. I wish we could, but this is another reason why it's important for different countries, particularly countries like India, to have several centers do the viral genomics properly, so that and also share those data properly, so that you know ahead of time if there are new variants coming up. So if I might make a larger observation, we have all spoken about the need to strengthen health systems, but I will say that what this pandemic has shown us is for countries like India and all countries in the world to strengthen the public health infrastructure at all levels. I mean, in the United States, we have an exemplar example like the Centers for Disease Control and Prevention, which is a large nodal agency which monitors data, monitors genetic variants, collaborates with academia, puts out surveillance data, and advises on the right ways to do things. So does India have such an agency, a central nodal agency which is so well resourced and with the kind of infrastructure? Does Brazil have it? I think these are the kind of questions we should be asking. So I would say, if there is a warning this pandemic has given us, it is that preparedness in terms of public health infrastructure, public health intellectual capital, healthcare infrastructure, and all other things are going to be important to overcome future threats, this current and future threats.
That's very useful. Mr. Gopalakrishna, Luther Mande asks, how are logistics being managed so that there's a minimization of shortages and misuse of equipment, wasting, equipment sitting in a warehouse as opposed to being deployed at the hospital?
So I think one of the major areas where currently people are focused on at this point of time is to ensure that we have a strong supply chain, to ensure that the commodities and equipment reach at the right center without any further delay. So I think whether the state government's focus or the federal government's focus. So the federal government actually has put a huge supply chain in place to ensure that all the internationally sourced assistance in terms of commodities and equipments are actually shifted to the states. And states actually have some kind of a mechanism to ensure that institutions are mapped where it is going, and then provide some support in terms of deploying that. So it is great that today we see, okay, an equipment is coming. I will give you an example of recent one donation for 30 ventilators, which happened to a state. So when we looked at the specifications of that ventilator, we realized that it's a very high-end ventilator which need piped gas to operate. So that then actually you started looking at which centers have the piped gas. So I think I can say that at least in this phase of the pandemic, there is a lot of focus on getting the deployment right, so that you don't have materials lying in the boxes for long. It gets quickly into the deployment. so that the benefit is really getting to the population faster.
Susan Hitchcock asked, and I think this is for both of you. What's the status of travel in and out of India, and how does limiting travel limit the spread of this virus or any virus? India's borders are still open with the neighbors, if I'm not mistaken, and we have flights going to and from India, but I think Australia cut off flights to and from India. How does that work?
So I think I'll just talk maybe within India itself. Now we have a lot of travel restriction. So initially after the first wave, there was a kind of a thinking that lockdown is not so highly effective. We went on to a massive strict lockdown fairly early, causing significant challenge for the livelihood of many migrant population. So I think there was a bit of reluctance in terms of doing the lockdown in the second wave. But now I think cities like Delhi, they clamped a lockdown for the last 3 weeks, strict lockdown. So they see that the number of new infections are dropping. And now there are a lot of states who are imposing barriers for people traveling across states. So somebody says that, okay, you need to produce your test status before you can go to another state. So I think there are a lot of controls even within the country at this point of time. And internationally, I think today, most of the countries have some kind of a travel advisory on people traveling out of the country. Australia is at one extreme, and Middle East also has banned travel out of country and into the country of the citizens. So I think it's going to be like one of the effective way to prevent transmission, but I really don't know to what extent we could really stop the virus from crossing borders.
So that goes over to you, Dr. Narayan. Does it work or not?
This is a very interesting and controversial topic. Again, the world is divided on this idea. In general, travel bans per se, except in very rare circumstances, have very limited, possible effectiveness. What is more effective, what is more important is proper testing and quarantine procedures and open sharing of data. Those are far more effective, whereas travel bans have a symbolic, emotional kind of message. Whether they really work, we don't know. In some cases, it's difficult to know, but I would say very strongly that regular program of testing, quarantine, masking, hand washing are far more effective, and avoiding crowding are far more effective than symbolic statements of travel bans.
My advice to you is don't run for public office. Politicians love travel bans. It's such a public thing to show that you're doing the right thing, right?
Yeah, I think Charles, you touched on a very important thing. I think this is where I would like to argue that the pandemic control and pandemic communication should happen from scientific experts and task forces with independents who are assigned a job, and politicians should support them and not be clouding the communication. When you look at the countries around the world that handle the pandemic well, it were countries where politicians supported the experts and the experts conducted the communication and made the recommendations. Exemplar examples like New Zealand, Germany, Denmark, and even in the United States, we have two types of politics, one in 2020 and another one in 2021. It's night and day. And I would say the good politicians should allow the good experts to do their jobs and give them all the support and resources and not get in their way.
That's good advice. Mr. Gopalakrishna, how does the Indian government plan to vaccinate 1.3 billion Indians? If only 2% of the people are vaccinated now, that's such a gigantic task. Both the production of the vaccines, but also the getting the vaccines into that many people's shoulders.
So maybe I think one area where possibly we could have paid a lot more attention was basically on getting the vaccine supply chain streamlined fairly early in the system. So that currently we are at 2% completely vaccinated and 10 to 12% would have got maybe a single jab. And we need almost like a vaccination of 9 million per day for us
Wow.
to ensure that by end of the year, we are able to at least vaccinate significant part of the population. And today we are almost at 3 million per day. So that means it needs to be really ramped up 3 times. And on the production side, though there are some large manufacturers of vaccines in India, currently the production capacity that we have is only roughly around 80 million doses per annum. So I think that's again a major area where capacity boosting is needed in terms of various other companies getting into the country. And recently we have allowed a couple of other international companies to really come in and bring their vaccine. So I think you need a lot more vaccine players in the country. Existing players need to really ramp up capacity faster. So I think these are all areas which are needed for ensuring that we have a strong vaccine response program. And financing is another major thing. We need almost like $7 billion to vaccinate the entire population. So this is currently provisioned in the country's budget. So the resources are available. It's a question of ensuring that whether we get the vaccine sourced at the right time, create the supply chain to ensure that the vaccine is transported to all the levels. So we have a fairly good immunization system in place. So that's where the advantage of some of the vaccines used, which need storage of 2 to 8 degrees, come handy. India may not have a supply chain to deal with maybe minus 40 to minus 70, which is needed for some of the mRNA vaccines. But we have actually one for 2 to 7 degree. That's where we need to see a lot of ramping up of maybe the AstraZeneca version and maybe the ramping up of some of the Indian vaccines and other international vaccines, which could potentially be used for getting this level of scaling up.
I hope everybody is listening to this and is getting ready to go online and make a donation to Care India. I think it's been distributed through the chat function. We will certainly send the link to everybody who's registered for this program immediately afterwards. We'll send you both the video once we get it uploaded onto YouTube. And then we will also send you the link. And actually it just went out, the link. Thank you so much. Please make a donation to Care India. Please help us. Help Mr. Gopalakrishna and the staff of Care India with this monumental task which they're taking on. And as Dr. Narayan said, it's not just for India, it's for ourselves, right?
Absolutely.
You know, this isn't an act of selfless generosity. This is an act of self-interest that we need to work together in a global community in India, in Brazil, in Mexico, all over the world, so that we can be safer here at home. So please, everybody, take out your credit cards, go online, make a contribution. I intend to do so right after this. It's really important that we do so. We've answered all the questions that you've sent in, so I want to thank you for the questions. I want to thank our two guests. This has really been, I've learned a huge amount. So Mr. Gopalakrishna, thank you so much. And please thank your staff at Care. I didn't ask you, how many people work for Care India?
We have 2,500 permanent staff.
Wow.
And then for the COVID response, we just got onboarded another 2,000 staff.
And this is spread across the country?
Spread across the country.
Wow, that's impressive. So thank you very much. And Dr. Narayan, thank you so much. I mean, this has been super informative for me. I feel like it is so, you know, when you get into a technical area, for us to understand what's going on is so complicated, and we need people who can explain it in a way that we can understand. So I want to, once again, urge everyone to make a contribution to Care Atlanta. Please share the recording of this program with your friends and family. We've got some upcoming programs that I'm not even going to mention. Please go to our website, World Affairs Council website. We've got great programs coming up on terrific topics, and we would love to have you join in. I want to thank our partners, Trevor Williams from Global Atlanta. I want to thank our staff, Leah, Valoran Lopez DeFrank, our producer, Laura Brower, assistant producer, Hina Rini, program director. Thank you again, Manoj Gopalakrishna and Venkat Narayan, for what has been a truly fascinating 50 minutes. So thank you all very much. And I'm sure you're going to see this huge uptick in contributions to Care India as a result of the past hour.
Thank you so much.
Thank you very much. Thank you.
The opportunity and the generosity of all the members.
Trevor, you want to come on and say goodbye? He's muted.
Just wanted to say thank you so much for working with us on this, Charles, and thank you to Manoj. Your staff had approached me about interviewing you, and I think it was much better to do it publicly than just the two of us. So I'm glad that we were able to do this. Thank you for letting us contribute.
Thank you all very much. It's been a pleasure. Thank you. Bye-bye.
Good, thanks. Everybody have a good morning if you're in the Eastern time zone, and have a good evening if you're in India time. So,
Thanks.
okay.